Hey, my name is Debbie Cormier and I'm a registered nurse. Today I'm going to be performing a full body assessment on a real live person. I'm a student at William Carey University and this is one of our assignments to complete. So first I will knock on the patient's door and wait to be welcomed in. And then I will wash my hands and introduce myself to the patient and tell them what I'm about to do. So look and listen as I illustrate.
Come in.
I'm washing my hands. Hey, my name is Debbie Cormier, and I'll be your nurse today. Today I'm going to be performing a full body assessment on you today. Is you okay with that? Okay. First, I want to ask you your name,
My name is Sheikah Smith,
date of birth.
51086.
Okay, Miss Sheikah. Could you tell me where you are today?
The doctor's office
Could you tell me why you're here?
for a checkup.
Do you know what time of day it is or what day it is?
3 o'clock.
Okay. All right. Miss Sheikah is alert and oriented times three, person, place, and time. Then next, I'm going to start off taking her vital signs. I will count her respirations. I counted her respirations as I was talking to her, and they are at 18. Unlabored. She's not having a hard time breathing. She's not using any accessory muscles. Then I will check her blood pressure. I have a stethoscope and a cuff. Okay, Miss Sheikah. It's gonna be a little tight on your arm, okay?
Mm-hmm.
Miss Sheikah's blood pressure was normal, 122 over 80. Okay? And then I would listen to Miss Sheikah's heart rate for one full minute, her apical heart rate. Okay, I'm gonna touch you right here, Miss Sheikah. Okay, you will listen to the apical heart rate for one full minute. Miss Sheikah's was 70, okay? All right. I will check Miss Sheikah's pulses, radial pulses, bilateral, and make sure they are equal. And you will check pulses for one full minute. Miss Sheikah's pulse was 66. All right. I would also then check. I check her respirations. I will also check her temperature. Miss Sheikah's has a normal temperature. Miss Sheikah's, have you been having fever or of any kind? Okay, Miss Sheikah's have a normal temperature bilaterally, upper and lower extremities. Have you been having any kind of pain
No, ma'am.
anywhere on your body?
No, ma'am.
All right. She don't seem to be in any type of distress. So then I will start with my general. I did my baseline vital signs on Miss Sheikah's. Then I will start with my general body assessment from head to toe. I will be assessing Miss Sheikah's range of motion, her strength. I will look at the normal aspects of her face, how she's dressed, her general appearance. Um, is she able to hear? How is she able to see good? Any abnormalities in her mouth? Any abnormalities with her gastrointestinal system, her urinary system? um, her vascular system. I will check all of those things. So watch as I illustrate. Okay, Miss Shifu, are you able to flex and extend your neck? Are you having any pain while doing this?
No, ma'am.
Could you go from side to side? Okay, Miss Sheikah don't seem to be having any pain or distress while doing range of motion on her neck. Um, I'm gonna palpate in her head to see if she have any kind of lesions or knots or anything. Miss Sheikah, could you tell me, have you been having any problems with any sores or anything in your head?
No, ma'am.
Okay, she denies any sores or anything in her head. I will look and see if her ears are symmetrical on the side of her head, which they are. Could you turn your head sideways for me? I will look in her ear and make sure she doesn't have any serum in there and she don't have any drainage coming out of her ear. All right. Okay. Could you hold your head up, Miss Sheikah? She have a trachea. Her trachea is midline. No jugular vein distension noted. Um, she's not having any throat pain. Have you been having any throat pain or anything like that? Trouble swallowing or anything?
No, ma'am.
Okay, she's not have had any trouble swallowing or anything. I'm gonna look at her eyes, accommodation of her eyes. Could you follow the pen for me, Miss Sheikah? Okay. I'm gonna check her eye reaction to light. Okay. Okay, her eyes is equal and reactive to light. Have you had any trouble breathing through your nose?
No, ma'am.
Her nasal passage is clear. Could you open your mouth for me, Miss Sheikah? Okay. Could you raise your tongue for me? Miss Sheikah's tongue is pink. She don't have any visual lesions. Do you wear any dentures or any such?
No.
Mrs. Sheikah's teeth are in great condition. No dentures noted. Gums are pink. She have no difficulty lifting and lowering her tongue. Okay, Miss Sheikah. Do you have any trouble swallowing? No trouble swallowing. Okay. If that's all with your face, we're gonna go to your breath sounds. I see that you are breathing normal and your respiration was 18 just a minute ago. I ask that you breathe normal while I check your lung sounds, okay? Have you had any recent coughing spells or anything like that? Okay. Well, I'll check your lung sounds, okay? Breathe normal for me. Okay, Miss Sheikah. I'm gonna ask that you roll on your side so I can listen to your posterior lung sounds. Roll that way for me. As of now, Miss Sheikah has clear lung sounds, no difficulty breathing. She's not using any accessory muscles. Everything is clear. I'm gonna also know the contour of her back. It is in line, no deviations from normal. I'm gonna listen to her lung sounds again. Miss Sheikah, could you breathe in and out normal for me? Okay, Mrs. Sheik is not having any trouble breathing at all. You can roll back over flat for me, Miss Sheikah. Okay. Miss Sheikah, when was your last bowel movement?
Yesterday.
Could you describe it for me? Was it formed? Was it discolored? Did you have another color or anything like that? Or could you describe your bowel movement for me?
It was normal.
Okay, it was normal. Miss Sheikah's abdomen seems to be symmetrical. I would listen to her bowel sounds, and then I would palpate and see if she have any nodules or anything in her stomach that will be out of the norm. Okay. Okay. Listen to her bowel sounds. Okay. Mrs. Chica bowel sounds are normal. I'm gonna palpate and you tell me if you feel any pain, okay? I'm gonna palpate and see if I feel anything out of the norm. Okay? She's not having any issues with her stomach or anything, her abdomen, I mean. I'm gonna ask that you flex and extend your arm, Mrs. Sheikah. Okay, she don't. Are you having any pain with flexion and extension of your arm? Okay, she's not having any pain. I would ask that you flex and extend your fingers. Are you having any pain with that, Mrs. She? Because I don't hear any popping, so there wouldn't be any crepitus, which is associated with arthritis as you get older. Okay, Mrs. Sheikah, your skin turgor seems to be intact. Your skin is warm. Your capillary refill is okay, and you are not having any difficulty with fleshing and extension of your arm. Um, I would ask that you, let me see, do you have problems with any moisture? Do you be over sensate like preparation, sweating a lot on your arms or anything? You don't have any problems with that. So she should be okay with moisture. I ask that you I'm gonna go on down and I'll come back. Do you have any problems with urination? How often do you urinate, Mrs. Sheikah?
Probably about 6 times a day.
Okay. Do you have any burning or anything, pain during urination?
Mm-mm.
Okay, Mrs. Sheikah don't seem to be having any problems with her urinary tract. Okay, we're gonna move on down, and I'm gonna ask Mrs. Sheikah to flex and extend her legs. Just checking range of motion. Could you flex and extend both your legs, as in this sort? Flex, extend. Could you do both of them at the same time, please? Okay. Okay. Could you flex and extend your feet alone? Okay, I don't see that, Mrs. Sheikah. She didn't have any swelling to upper extremities, and she don't have any to lower extremities. She have bilateral pedal pulses that are equal. Skin temperature is warm. Capillary refill is less than 3 seconds. Mrs. Sheikah, I'm going to ask that you hold your feet up straight and push against my hands. And that's just checking strength. Miss Sheikah has equal strength to lower extremities. Okay. Okay, Miss Sheikah, I would like you to stand up for me. Okay, I would have Miss Sheikah to turn and walk to that wall and back just to check her normal balance coordination while walking. Okay. Now walk back to that wall for me and turn around. Okay, I'm gonna have Miss Sheikah to put her hands up in this motion, and as I press against her, I'm gonna have her to press back against me just to check her strength in her upper extremities. She had adequate strength in her lower extremities, so I would be checking her upper extremities now. So Miss Sheikah, if you would, once I hold pressure, you just try to push against me, okay?
Mm-hmm.
Are you having any difficulties? All right, Miss Sheikah, you can take a seat. Okay, you had upper and lower extremities strength. Have you been having any tingling or weaknesses in your tingling or numbnesses in your fingers or in your feet or anything like that? Okay, she denies any numbness and tingling in her upper and lower extremities. And Miss Sheikah, are you have you been having any kind of you denies any numbness, right? So you don't have any kind of problems with sensation. If I pinch you right now, you wouldn't have any problem with that, right?
Yeah, I have a problem with it. It hurt.
Okay, Miss Sheikah seems to have um okay, um no problems with sensation at all. She had no problems with any of her upper or lower extremities, no problem with breathing. Mrs. Sheikah was a great candidate for a full body assessment. And Ms. Sheikah, I would like to acknowledge my camera crew, and I would like to thank you for giving us this opportunity to perform this full body assessment on you today. And I thank you so very much.